What's up, team? If you can hear me and see me, then it means that I'm live. I'm just waiting for confirmation on the old YouTube, and it looks like I'm live. Good stuff. Welcome, everybody. Today I'm answering a question, a really common question about slap tears. What do you do if when you reach for things you feel a sharp pain, but then when you kind of move your shoulder around you get like a pop and a clicking sound and then the pain goes away? Is that something that I need to worry about? That's a question that was asked to me by one of our UMS tribe members, Chris, who is currently rehabilitating his slap tear at the moment. And it's something that I've been asked many times before, and it's something that I've had to deal with myself because I've had a slap tear in both shoulders, and I went through all of it, where like nothing would hurt, I'd be completely fine, and I would go to reach for something in one of those higher shelves up there, and I'd just get this sharp pain as I'd go to reach, and I'd have to come down and kind of like move my shoulder around a little bit. And then all of a sudden the pain would go away and I could reach up there. And so in today's episode, I'm going to talk you through what that possibly is. And I'm going to talk you through how you can fix it and whether it's something that you need to be concerned about. Because of course, anybody watching this, you've most likely got a slap tear or some kind of shoulder problem and you want to avoid surgery. You want to be able to get back to the things that you love to do without having to go under the knife. And I know that that's certainly what I want and what I wanted. And I'm fortunate enough that I got to work with some exceptional sports physical therapists who are, they work only with professional athletes, but because they're friends of Yanni and mine, they made an exception for me. And so I got great advice that got me back to where I am now, which is stronger and more flexible than I was before I had the slap tears. So what goes on? Let's first talk about briefly what's potentially going on. So when you look at the shoulder here, and you have to excuse me, I've just Googled rotator cuff so that you guys can sort of have a little look at what goes on in the shoulder, because the shoulder is by far the most complex joint in the human body. There is so many things going on in the shoulder. So why is it such a complex joint? It's got more range of motion than any other joint. There's no joint in the body that can do all of this stuff. It can abduct, adduct, it can flex, it can extend, it can rotate, and then it can do all of the different things in between. You compare that to the elbow, or compare it to the wrist or the fingers, or even the hip, because the hip and the shoulder are the only ball and socket joint. But the hip is much more of like a huge capsule like this that holds the head of the femur in it to really limit range of motion, which is why hip dislocations are far less common than shoulder dislocations. Because if you dislocated your hip, you'd be in a lot of trouble. And people that have dislocated their hip is, permanently changed forever after that. Whereas the shoulder, although it is still considered a ball and socket joint, it's much more kind of like, it's like a little socket like this with a ball in it like that, where the ball can potentially be pulled out of the socket much easier. And it needs to be like that so that it can move so much greater range of motion rather than being limited to this kind of a range of motion. And, you only really need to look at the average person without having done any flexibility training. Most people would not get very close to the splits at all if they've never done flexibility training. They can probably only open their legs about that far. But when you look at your shoulders in comparison, when you look at like how much you can move your shoulders around, so we can see that there's so much more range of motion going on there. And then what the shoulder also has to do is it has to be able to produce a huge amount of strength. So, you look at all these muscles up here and you look at what we have to be able to do with our arms and pulling and pushing. And, if you look at the upper possibilities of what human strength is, you look at Olympic weightlifting and calisthenics and things like that, there is, this huge possibility of strength within the shoulder. And so the shoulder has these incredible muscle systems that have to be able to hold the humerus. So this is called the humerus, this bone here, and it has to hold it in the glenohumeral joint, in that ball and socket joint, and it has to keep it still. It has to prevent it from gliding around like this, but it also has to allow that range of motion. So the first thing to understand is that when you look at the complexity of the joint here, there's a lot that can be happening within here. So this is the biceps coming up here, the long head of the bicep. And if you actually look at a slap tear, that's the long head of the biceps here, the tendon of the long head of the bicep, which connects onto the superior labrum. So that's the labrum there. That's what the head of the humerus sits in. So you can see what I mean by that ball and socket joint. Like it's a really big ball and a really small socket, okay? And then the slap, the tear, the superior labrum anterior to posterior. So the superior part of the labrum, a tear running from the anterior to posterior part, excuse me, of the labrum, is it's often associated with biceps tendinopathy. Oh God, I'm not sharing my screen, am I? Great work, Rad. It's early over here. It's 5:40 a.m. So excuse me. So there you go. You can see the labrum there. So that's the labrum. That's the biceps tendon there, and the biceps tendon, the long head of the biceps tendon comes up, connects onto the labrum, and that's where the slap occurs. The superior labrum, so that's the inferior labrum, superior labrum. So superior is higher, inferior is lower, and then anterior to posterior. So running from anterior, or AKA front, to posterior, or AKA rear of the body. So that's what a slap tear is. So you can see that if you've got a slap tear, it's heavily associated with going on in the bicep, what's going on in the biceps. And in my case, it was an abusive load from the biceps on the slap tear, because I was working on planche, and in planche, your hands are here, but there's an immense amount of load on the bicep pulling this way. So your bicep is pulling this way to hold you up when you're trying to do planche work. And that's what happened in my case. That load from the long head of the bicep, it pulled the labrum down, and I had a slap tear. And then when you look at the rotator cuff, you've got the subscapularis here, you've got the supraspinatus that runs along here and connects onto the top, here we go, onto the top of the humerus. You've got the infraspinatus, and you've got the teres minor at the back. And what the rotator cuff does is, it's these four muscles where, this is not a great way to, look, I'll try and demonstrate it here, but it's easier with my fingers. So you look at the humerus there, and you can see the rotator cuff all connecting to different parts of the humerus. And so what they do is, if this is your humerus here, and you've got these four muscles grabbing on the top of it like this, so you've got on the front coming from the back of the scapula, so that you can see here, like it covers pretty much the whole front of the scapula, like that's behind your body. This is all on the back, but it's sitting on the inside of the scapula, and coming onto the front of the humerus is the rotator cuff. So that's back there on the front of the scapula, and then it comes up around the front and hooks onto the rotator cuff there, and they all connect onto the scapula, all of the rotator cuff muscles. And then the supraspinatus comes down this way, and then the infraspinatus, and then the teres minor, and they all grab onto that rotator cuff, and they create what's called a force coupling. And a force coupling is when you've got two forces pulling in alternate directions that hold something in place. So a good way to understand how a force coupling works would be maybe on the hinge of a door. Like if you look at the hinge of a door, you've got the hinge anchored on one side, and you've got the hinge anchored on the other side, and they're both pulling, and they hold that door in place. And if one side wasn't pulling, then the door would just fall that way. And so the same thing happens in the shoulder joint here. If there's one side of the rotator cuff that isn't doing its job well, then what happens is, and all the other sides are pulling, then you get bias being pulled in that direction. And so instead of that joint sitting in its anchor like this and moving like that, if it's being pulled in this direction, then when it moves that way, it's going to be biased to glide that way as well. And that means that you get incredible pain. That was something that I learned all this because I've had a slap tear, right? I'm not a physical therapist, but because I'm somebody that's obsessed with being able to do, movement and things like that, I really went deep into learning this. And because when I had my slap tears, I had these two physical therapists, Phil and Nilesh, who are both exceptional sports physical therapists, and they were working at Unity Gym with us. So I was there, I could ask them questions every day, and we were doing weekly live streams. Actually, we were doing daily live streams back then. So we were doing daily live streams like this, and we were sitting around a table. You can see them all. They're up on our YouTube channel, of course, and on our podcasts. And we had... So I was just having conversations with them, and people were asking questions about slap tears, and I was just able to have these open conversations with physical therapists, which is how I learned all this stuff. So anyway, so the joint glide is what causes so much pain. So joints meant to move like this, but then if it's biased to one side because you've got imbalances in the rotator cuff, or the rotator cuff isn't doing its job properly, then the joint's going to start moving like that, and that's when you get agonizing pain, because that's when it starts hitting nerves, and you'll move like this and it feels absolutely fine, but then you'll go to reach for something high, like where I noticed it the most in my earlier days of slap tests. So in the earlier days of slap tests, I couldn't even lift my arm past there. Like if I even tried to lift my arm past there, the pain was so sharp that I just couldn't move it anywhere at all. So let's fast forward several months when I was working out and I was, being able to do my weightlifting and everything. But then I'd be at home and I'd have no pain, and I'd reach for a cup in our higher shelf. All our cups are in a shelf that's about head height, and I'd go, like that, and I'd feel this really sharp pain out of nowhere, and I'd have to kind of like roll my shoulder a little bit, and then I'd go for it really carefully again, and there was no pain at all. And it was often associated with like a clicking. Like I'd go like this and you'd hear this, like you'd hear a click and you'd feel something click within your shoulder, and then all of a sudden the pain would be gone. And I'd get the same thing when I'd try and raise my arm somewhere, and I'd raise it and there'd be this, and there was no pain sometimes, but that would get rid of pain. And so that's really what this question is about. Chris has asked this question, what happens when you get this this clicking and this sharp pain? No, I have some very, very, very strong advice for you that I'm going to give you in just a minute. And in the short term, what I'm going to say is, I'm going to be very direct and very frank. Do not go straight for surgery. Marin, who's just commented there live, is a doctor. She is a practicing doctor right now. So you're getting told by somebody that's gone through this themselves. Doctors do not, to a surgeon, to a hammer, everything's a nail. And so a lot of surgeons recommend surgery way earlier than what it should be. Look, I'm gonna sidetrack here a little bit, because I know so many of you guys want to avoid surgery, and I'm going to be really direct with you, man. And before I say this, of course, take this with a grain of salt. I'm not a medical professional, so this is not medical advice, and you couldn't consider that. This is advice coming from someone who has had what others call a miraculous recovery, not just in one slap tear, but in 2 slap tears. And I've delivered those same results to hundreds of people around the world. And I'm going to share something with you in just a minute as well to give you a little bit of proof of that. So, and again, but the advice that I'm giving you isn't coming from Dr. Google. I didn't Google for 5 years to get what I'm giving you. I worked directly, face to face, with exceptional sports physical therapists to get the opinions and the knowledge that I'm now sharing with you. And I asked, so I'm gonna Google Nilesh and bring him up so you can see who he is. So Nilesh is the current head sports physical therapist of the Newcastle Knights, and the Newcastle Knights is one of Australia's premier football clubs. So these are the highest athletes in the world. They're the best of the best, and that's him. That's when he was a physical therapist for the GWS Giants. So he's been a sports physical therapist for professional football clubs in Australia for about 15 years now. And to get to that level as a physical therapist, you are in the elite, probably 1 in 10,000 physical therapists in the world. You're in a completely different league to the physical therapists and doctors that you will see when you just go down the road to see the doctor or to see the physical therapist. Like, it's incomparable the way that these guys treat people. So that's where this advice that I'm giving you is coming from. And when I said to him, what does one of your players do when they get a slap tear mid-season regarding surgery? And he said, we don't go near surgery. Surgery is the absolute last option, because surgery requires months of recovery. It means that they're out for the entire season. Like, if they opt for surgery, that's the season gone for them. So it's an absolute no-go. And it's also irreversible. And this is his own words. This is that level of physical therapist saying this to me. He said, in 60% of cases, symptoms don't improve when you get surgery. I'm going to say that again, and I want you to pause for a minute. In 60% of cases, slap tear symptoms do not improve when you get surgery. It is the absolute last resort. You will never be able to undo it. You cannot get surgery recover, and then go, fuck, my shoulder's worse than I had it before. Can we just undo that surgery, please? Too bad. It's there. It's there forever. But you always have surgery as a later option. It's always there for you. So the way that they treat professional athletes is they do rehab, which is exactly the stuff that I can show you because I learned it from Nilesh. They get them back on the field as quick as possible. They go through the season, and if at the end of the season, if their shoulder is still causing them real problems where they think surgery might improve it, then they go and get surgery. So I would strongly advise that you do not go and yeah, look, I get it, man. Look, I'm going to be really frank because I don't have a lot of time. I've got to go in a couple of minutes. You've been doing physiotherapy for a year. You haven't done it with me. So I've got no idea what you've been doing. And I have, I'm going to read you real quick. I'm going to do a shameless plug here. I'm going to read you a review that came through just last night so that you can hear what other people say about when they work with us online. So this is from Mike. And Mike says, so I've just Googled Unity Gym here. Mike says, after being diagnosed with a severe case of shoulder bursitis, severe case of infraspinatus tendonitis, small case of teres minor tendonitis, I'm guessing perhaps partial distal bicep tear, and most severe of all, a 10 to 15% slap tear. Turning doorknobs, stirring foods, and wiping motion, turning my steering wheel would cause me endless pain. So forget about reaching anything above nose area. I became right-handed for many things. I've seen countless physios, chiropractors, massage therapists, and even got the PRP injection. Some of it did help, but nothing brought me the results and value, anything close to what Rad did at Unity Gym. I found him on YouTube and started his blueprints. Only 5 weeks in, I was seeing a massive change in my day-to-day basis. Being a fitness and cycling fanatic, I knew I had to join his program to be back at my prime. After only 3 weeks, I was living pain-free. Being a professional butcher and chef, that's nuts. If I wasn't into, so it goes on. And that is, we've got 314 Google reviews. If you go to our recent reviews, every 5th review is somebody with a slap tear that's had a similar result. So, man, look, man, you're never going to be able to undo surgery, but you can postpone it, and you could try this for a month, and then you could decide after a month, no, I'm just going to go and get the surgery. But if you get the surgery and then say, shit, I should have tried that, it's too late. Anyway, so back to this, because I've got to go in a minute, so I'm going to finish this up real quick. So the clicking and the things that go on, when I asked my physical therapist friends, they actually couldn't give me a solid answer of, it's this or it's that or it's that. What I got told is there is so many things that it could be, and don't worry about it at all, because it will improve. And if it isn't associated with pain, so if you get clicking when you move, and when I was in the earlier stages of my rehab, like when I'd do external rotation, I swear to God, it sounded like this. It'd go. It was the most horrible sound. It was like this grinding sound of bone on bone. And the physical therapists just said to me, it's okay, don't let the sound get you down. If you can do the movement, then you keep doing it. And I now have absolutely no pain, no sounds and no pain. And I've coached so many people that have gone through the same experience, and I've given them the same advice, reassured them that it's okay. And a month later, they're not hearing any crackling sounds or anything at all. So what happens is, it's those structures that are meant to hold that humerus in place and keep it working properly. They're not doing their job properly. You're getting slight amounts of glide, slight amounts of movement. That causes crackling and clicking sounds. It freaks you out. But over time, as those structures strengthen and they start doing their job properly again, then you stop hearing the sounds and you stop feeling the pain. And this is the golden rule with slap tear rehab. Pain during the exercise is not so bad. If the pain goes away after you're doing the exercise, you're okay. If the pain persists after the exercise and your baseline level of pain increases, meaning that, that level of pain that you feel when you reach for something or when you're just going about your day to day, if that increases, then you have gone too hard, and we need to make adjustments to your program. And that's what we do on the fly with people. We make adjustments with programs to make sure that they're progressing without their baseline pain increasing. And that is it in a nutshell. And then the last thing that I want to say is this. This was one of the funniest explanations of slap tear that I've had, and it was from, again, one of my friends who's an elite sports physical therapist for professional footballers over here. And what he said to me was, He just said, when you get a slap tear, all of those structures, the scapula stabilizers, the rotator cuff, they forget how to do their job properly. They've all got a job to do. They stabilize the scapula, they stabilize the shoulder, and they basically forget how to do it. And when you do rehab in the earlier phases, you're reminding those structures how to do their job properly so that you're not getting abnormal shoulder movement and you're not getting abnormal glide. And as soon as they get reminded how to do their job properly, the pain goes away. And man, it happens so fast that the pain goes when you start doing the right exercises. So for anybody that's watching that is really suffering with pain, and especially if you're sitting here about to get surgery, I would say that you owe it to yourself to try this stuff. In the very least, go and download our slap tear rehab blueprint. It's free. Go to unitygym.com/slap tear blueprint. And if you just want to skip to the good stuff and go straight in, go to unitygym.com/slap tear and get started. If you start working with me, you will work with me directly. I will be in contact with you within 24 hours to review your questionnaire, create a custom program for you. I'll be communicating with you and I'll be guiding you every step of the way and making sure that you get the best recovery possible. And we have an incredible rate of success. If you look at our Google reviews, it's just review after review after review of people saying that it's just changed their life. So I know that that's a shameless plug, but it's the truth. And Nia, I am so sorry, but I have to run. I've got to teach a class in a minute. I'm going to have students rocking up to my place here. I've got a gym out there that I'm going to be teaching in a sec, so I'm just going to fly through this. You've been doing, yeah, I read that one. And Mr. Tigris is saying you've got biceps tendonitis in the shoulder. You're saying in how many weeks can I expect a full recovery? I can't say that because that's like saying how long is a piece of string. And everybody's shoulder is completely different. There are so many factors that determine how quickly you'll have a complete recovery, how bad the injury is, how strong you were before you did the injury, how much muscle mass you have, how old you are, how committed you are to your training, how much rest you get, how good your diet is, do you abuse drugs and alcohol? Like there are so many things that are going to determine how quickly you get a good result. But I can tell you this right now, the best chances you've got is working with a coach like me who's walked the path that you want to walk before. So you want to work with somebody, not just who knows how to do the stuff, but somebody who's gone through the process before. And also, if you fully commit to it, if you go for it and you do everything that your coach says, then you're going to have the greatest chance for success. So I really hope that that is something that you do. Nia, I hope I'm saying your name right. Much appreciated. You're saying you're welcome. I really hope that this helps you. And I hope I didn't come across too pushy. It's not my intention. I do have to go now though, and I really want to help you. And I believe so strongly in what I've told you. It's not something that I sort of sit on the fence with. I'm very passionate about this stuff. So yeah. All right, team. So I've got to run. If you've got questions, these live streams are all about me answering your questions. So post your questions. Let me know what you want me to talk about, and I'll see you tomorrow at the same time. Have a great day, everybody.